A great patient for us is again somebody that is highly motivated and invested and wants to work and wants to get better. So those are usually the patients that we see here, and the patients that actually do get better, and that you can see them from, you can see the big difference when they respond to treatment, and how they are happy, how they are pleased with what they have achieved, they have overcome a crisis. So those are the type of patients that are a good fit for us.
I think really it's what the whole support and admin staff puts into it, as well as the providers, of course. I think there's a really good teamwork aspect here, and everyone's looking out for the best interest of the patient as soon as they walk through the doors. So that's one thing that I've really valued here versus other clinics I've worked at, in the sense of it seems like everyone, I know it's cliche, but truly does care and wants everyone to have both a great experience, I think, from the office and admin staff perspective, but also have good clinical outcomes from the provider perspective, and again, hopefully get everyone living the life that they want to live and finding meaningfulness and enjoyment on a day-to-day basis.
I'd say that the first thing would be great providers, great clinicians that have your best interest at heart. I would say the second thing would be the non-clinic-y feel to our practice. We've got some great people here and a really relaxed environment that can make you feel comfortable as you're coming in. I know each appointment, is, in addition to the initial appointment, can be very, very stressful. So we've done all we can to really make it as comfortable as possible for you. The other thing that's great about being a client here at Cognitive Psychiatry of Chapel Hill is the fact that you get to interact with myself, with Tony, with our admin team. You've got somebody that's going to answer the phones. You've got somebody that's going to talk to you about anything that's needed. And we're always here for you. So there's always somebody that's just a phone call or an email away. And I would say those would be the main reasons to be a client here at Cognitive Psychiatry. Thanks.
So in terms of what kind of patient is a good fit for us, or why anybody watching this video might want to join us here at the practice, I really started this practice in response to kind of how it was like for me to be a patient in other doctors' offices and to deal with a lot of the frustrations that I personally experienced. So I've been very thoughtful over time, and as we've grown, the staff here, the other providers, all have the same vision, which is that we want to treat you the way that we want to be treated ourselves. So what does that mean? That could mean different things. For me, one of the main things I hated about going to doctors was waiting. So I would get very frustrated. I would make appointments 8 a.m. in the morning, hoping to be the first person there, and I'd get there and they'd say, well, it's a 20-minute wait. And I was like, well, I scheduled the first appointment of the day. How could you possibly be behind? So for me, time is one of the most valuable things, if not the most valuable thing I have. So wasting time, or at least, not being able to predict the time has been really difficult. So if you are someone like me, and your time is valuable, and you don't want to waste time waiting and getting impatient and frustrated, this is a great place, because we all focus on being on time for our patients. Another thing that frustrated me about providers was it was difficult to get the right information at the time that I needed it. So I would call, and maybe I'd have someone on the phone who was really nice, but they couldn't really help me, or I'd have to leave a message and someone would have to get back to me, or I'd want to be able to send an email, but then they'd say, well, we can't accept emails here. And so it was hard for me to communicate with them when I needed to, like when it was convenient or important to me. So here at Cognitive Psychiatry, we've designed the systems to make sure that everybody has access to their doctor when they need it. So, you can contact us via phone, via email. There's going to be someone here who will pick up and respond to you quickly and efficiently and know how to help you with your problem. And that's really, really important to me. And so that's something, if it's important to you, I think you would really like about us here. And then I think finally, the other thing that is important to me, and I know other people, is that the space we're in, the environment that we're in, is a welcoming, warm environment that's professional and kind of modern. It feels comfortable if you like that. So if you're the kind of person that wants something, that's very homey, like in somebody's private home or something, this is not going to be a good fit for you. But if you're someone that likes to be somewhere that's kind of an open, airy, modern, warm environment, that's really what we strive for here. So you can see me, I'm looking out the back window. We have nice views here. That's important to me, and maybe that's something that's not important to you. But the environment here, just to make you feel really warm and welcome before you even talk to anybody, that's something that I think we do well.